Okay, so another change of subject now. We're talking about skin now. Looking after your skin. MPNs have a nasty habit of affecting your skin, and some of the treatments exacerbate that. I'm not itching too badly today, but it's something that I have struggled with a lot over the years. But to talk to us about that this morning, we have Dr. Kulakov. Now, she works at UCLH, so finally not somebody from Oxford. And she's a specialist in skin cancer. So specifically, she's going to be talking to us about that. And as I say, there will be time for questions to any of the doctors at the end of that. Just one thing before we start the next talk. For those of you who are watching online, can you please put your questions to any of the doctors in the chat on the, is it Zoom that we're using? I can't remember, but whatever the online platform is that we're using, if you could put your questions in the chat, we have somebody monitoring those questions, and we will put those questions to the doctors after this talk. Without further ado, Dr. Kulakov, if you could come to the stage, please. Oh, it's a recording. I'm sorry. I should have known that.
I'm a dermatology consultant at UCLH. And thank you so much for asking me to talk to you about looking after your skin with MPN. I'm going to talk briefly about the importance of skin health in MPN care, talk about sun protection and other behaviors to decrease your risk of developing skin cancers, cover self-monitoring, what to do if you are concerned about any skin changes, and also a brief run through some common types of skin cancers that we see in dermatology practice. The skin is the largest organ of the body. Skin problems are unfortunately very, very common. Skin cancer is also common, and rates are constantly rising. 1 in 4 men and 1 in 5 women can expect to be diagnosed with skin cancer at some point in their life. We know from studies that the risk is increased in people with immune compromise, but it's very important to realize that the majority of skin cancers are preventable, and the ones that aren't preventable are very easily treated when they are caught early. Skin cancer prevention starts from birth. We know that ultraviolet light radiation causes sun damage, which very gradually builds up over time. That sun damage leads to wrinkles, uneven pigmentation, loss of elasticity and broken capillaries. And all of these changes can also lead to skin cancers. Behaviors can significantly modify risk and then prevent skin cancers. And you can do all of this whilst continuing to lead a full, healthy and enjoyable lifestyle. Sun protection is essential. I would advise that you cover up using SPF certified clothing, seek shade, and also avoid sunshine between 11 a.m. and 3 p.m. Now, this behavior is very important, not just on a sunny holiday, but also in your day-to-day life in the UK, as well as when you're abroad. Consider using a high-factor sunscreen, which is at least SPF 30 or above, with an ultraviolet A radiation rating of at least 4 stars. You should apply SPF daily to all exposed skin at least 20 minutes before going out. One of the tricks to try and do is using it instead of face cream. You should also reapply after sports and swimming, and make sure that you use sufficient amount. And the recommendation is that 1 shot glass full is enough to cover the entire body. Sun protection should be used daily, and if you are at higher risk of skin cancers, then probably year-round. Self-monitoring is very important. Take time to examine your skin regularly. You should stand in front of a mirror and be undressed, at least down to underwear, and then use an algorithm of A, B, C, D, E, which I will go over in subsequent slides, to look at moles, and then record all the various spots, such as using photographs, or there are some smartphone apps which make it easy. Once you get used to looking at your skin all over, it should only take 10 minutes. And typically you should examine your skin every 3 to 4 months. If you are concerned about anything, please see your GP to ask their advice. It is perfectly normal to develop new freckles, patches, discoloration over time. The vast majority of these are not concerning, but all of them should be checked out. And typically, if you develop any new moles, any persistent scaly red patches, any non-healing or painful areas, you should attend the GP. Try and see a GP quite quickly, typically within 2 weeks of finding a new skin change. Your doctor should ask you a full history and then examine the area by looking. Some of them might use a special piece of equipment called a dermatoscope, which is a magnifying glass and a bright light, helping doctors to see the skin in more detail. They might be very willing to reassure you with advice to consider continuing monitoring your skin. They might be unsure and in some cases send a photo to a dermatologist. And if they have slightly more concern or uncertainty, then they will refer you to the hospital via something called the 2-week wait route. And typically this results in an appointment with a dermatologist within a fortnight. At the hospital, it tends to be a very busy clinic. You may see a variety of different healthcare professionals, typically overseen by a consultant dermatologist. They will ask you a history and be sure to mention that you have a myeloproliferative neoplasm and also all your current and previous treatments, as these may all be very important. They will offer you examination, and in some cases they might offer you a full skin check, which would mean that they will ask you to take your clothes off down to underwear and they will look at your skin all over. Following this, they may recommend biopsy or removal, or they might reassure you. In terms of skin changes that are a bit more concerning and should be treated. So there are 2 different types of skin cancers. There are skin cancers that are called non-melanoma skin cancers and melanoma skin cancers. Typically people are much more familiar with melanomas, and these are dark spots or unusual moles. The non-melanoma skin cancers can be much more varied and can present as lumps or bumps or scaly red patches. One of the most common forms of pre-cancer or sun damage is called actinic keratoses. These are typically flat, scaly, pink or red patches, and these are early precancerous change. They are very common, and there is a small risk of them going on to form squamous cell carcinoma. There are many treatments that both your general practitioner and a dermatologist can discuss with you. In rare cases, the sun damage can then form a squamous cell carcinoma. This is another type of common skin cancer, and it is more common with people with myeloproliferative neoplasms, especially on some types of treatment. The skin cancer is invasive, and very rarely it can spread to lymph nodes and other organs. It means it's very important that it's treated quite aggressively, and that is typically done with either surgery or radiotherapy. And in the majority of cases, that treatment is curative. Basal cell carcinomas are the most common form of skin cancer. They are very slow growing and they do not spread. They do, however, grow slowly unless they are fully treated. There are lots of very successful treatments, such as creams in some cases, or surgery or radiotherapy. Typically, BCCs do not have an impact on your general health. So melanoma skin cancer is something that we're all quite familiar with. These are dark, irregular spots or moles that can arise on your skin. And the rules for helping you to spot melanomas are called the A, B, C, D, E rules. So we are advised that we look for asymmetry in the actual mole. Typically, the borders are irregular. There are lots of different colors within the mole. So you can have dark brown, light brown, red, black. The diameter can be larger than a normal mole. And then I would say the main letter of the mole is E, which stands for evolution or change. So any mole that changes should be examined by a doctor. So applying these rules can be tricky, but it's important to know what your moles look like. So any long-standing mole that is changing in shape, color and size, a new one, or even a flat sunspot which is gradually changing appearance should be examined by a doctor. Don't forget areas such as your back, or the tops of your ears, or even the soles of your feet that are not areas that we usually examine. They should all be looked at. The main thing is, please don't worry about bothering the doctor for nothing, because it's much nicer to reassure somebody about a non-concerning lesion rather than miss a melanoma. A melanoma is typically the most serious skin cancer, and it can spread and can have quite deleterious effects on your general health. The majority of melanomas are early stage and they're treated by removal. Stage 1 has a 97% survival of 5 years, and that does decrease the more advanced the melanoma becomes. There are, however, many excellent new effective treatments for later stage disease. However, early detection is vital. So in summary, you can take lots of positive steps to decrease your chances of developing skin cancer. Regular monitoring of your skin is very important, and if you are uncertain about anything, then please do ask your doctor or clinical nurse specialist for advice. Thank you very much for listening. Goodbye.